Boris Johnson will spend today resting in Downing Street after being taken to hospital this morning. The Prime Minister had a routine operation on the NHS in London shortly after 6 a.m. Few details were given by Number 10 about the hospital appointment, with officials eager to keep Mr. Johnson's health private. However, his official spokesman confirmed he was unconscious for a relatively brief period of time after being placed under general anaesthetic. He added that the very minor operation was related to his sinuses. The spokesperson said, "He went to hospital around 6 a.m. and the operation was carried out first thing this morning." He was back in Downing Street shortly after 10 a.m. The operation had been scheduled for a while, with Downing Street refusing to discuss whether the Prime Minister had been forced to wait for months on a waiting list. With Mr. Johnson recovering from his treatment, Deputy Prime Minister Dominic Raab has been asked to step up. "We have a Deputy Prime Minister who was aware of this in advance, and the Cabinet Secretary was also aware," the Prime Minister's spokesman said. "Should significant decisions need to be made, that would be for the Deputy Prime Minister at the moment." It is unlikely Mr. Raab will be called upon, but should any decisions on national security or other matters that may arise, he will be consulted along with the Cabinet Secretary on the best action to take. Mr. Johnson will take back the reins of government tomorrow morning, when he is still expected to chair the Cabinet. His plans to travel to a Commonwealth summit in Rwanda later this week are also unaffected by the operation. Mr. Raab was last asked to deputise for Mr. Johnson in the spring of 2020 when he was rushed to hospital suffering from COVID. The Prime Minister spent a number of days in intensive care where he received oxygen treatment. On that occasion, Mr. Raab was in charge for 20 days while his boss recuperated. Mr. Johnson's sinus issue is understood to not relate to his COVID illness from 2020. There is currently no formal provision in the UK for passing powers from the Prime Minister to a deputy if they are unable to fulfil their duties. A private member's bill, put forward by Tory MP Peter Bone, is currently being debated in Parliament to ensure there are legal mechanisms in place should the Prime Minister ever be unable to carry out their role. The Prime Minister, Temporary Replacement, Bill says it will make provision for the carrying out of the functions of the Prime Minister in the event that a Prime Minister, or a person temporarily carrying out the functions of the Prime Minister, is incapacitated.